Hello, my name is Nia Dobner and I'm one of the breast care nurses at Yeovil Hospital. Today I'm going to talk to you about lymphedema. All the information I have are from the lymphedema service at Yeovil and Taunton, and they've also produced the slides. Why am I going to talk to you about lymphedema? Well, when you have any surgery to the axilla or the armpit, this puts you at slight risk of having lymphedema. Some of you ladies would have had a sentinel lymph node biopsy, and this puts you at a very small risk of lymphedema. However, anybody that's had an axillary clearance or had radiotherapy to the axilla, this will be a very important information session for you. So what is the lymphedema system? Well, the lymphedema system is a network of vessels and nodes which is throughout your body. This drains excess fluid back to the heart. Lymph nodes are the filter system, and this helps to prevent infection. This maintains the balance of the fluid within your body, and it helps, as I said, infection. As you'll see on the screen now, this is an example of a lymph node, and this is really the filter system to the body. And because we've removed either a couple of your lymph nodes or substantially as many as we can, these are your filter system is compromised. So what causes lymphedema? So lymphedema is caused by the removal of the lymph nodes, which, as I stated earlier, lots of you would have had. You can also have damage to the lymph nodes as well, or the lymphatic system, and this can also increase your risk of edema, which is what lymphedema is. Surgery, radiotherapy, and also to some extent chemotherapy can also affect the lymph nodes. So I'd now like to talk to you about reducing your risk of lymphedema and ways that you can help yourself. We would like you to avoid having blood pressure taken on that arm, and also to have blood sampling or acupuncture on that side. When you are resting, we would like you to support your arm. Do exercises, they are really important. Swimming is the best exercise that you can do for lymphedema. Avoid repeated movement. So if you're on your computer and tapping away, just be mindful of that, as you may have problems with your arms a little bit later. Make sure you use a moisturiser both on your arm and your breast and across the chest wall. Check regularly under your breast for fungal infection, and if you notice that there is a fungal infection there, seek advice from your GP as soon as possible. Avoid tight-fitting clothing. Wear a good supportive bra. This is a key factor to reducing the risk of lymphedema in the breast. Use an insect repellent, because for some reason little mozzies like to bite you on that side, so put lots of repellent on there, especially when you go on holiday. Again, use lots of sunblock because we don't want you to get sunburnt. Wear gloves in the garden, and if you do get a cut or a graze on this arm, please look after it. If it looks like it's infected, then please seek advice from your GP. So what are the signs and symptoms of lymphedema? So the first time that you'll notice anything different is when your clothes start to feel a little bit tight. This usually happens just when you're wearing a top like this and you notice that this arm is just not quite as loose as the other side. Heaviness. The arm can sometimes feel a little bit heavy. You'll notice a swelling, aching, and you sometimes can see pitting in your arm. If it does get to this stage, then you do need to seek help. Now, you can seek assistance from your GP in the first instance. However, if he feels that there's no infection there, then us breast care nurses are more than happy to see you. What is the treatment for lymphedema? Well, to start with, it's imperative that you keep your skin really moisturised and your breast. So keep the whole area moisturised. I would recommend about twice a day. Exercises, this is the key factor. Don't hold your arms stiff, even when it feels a little bit swollen. I want you to do the exercises that we showed you post-operatively, and this really is a lifetime commitment of doing these exercises. If we notice that you have got swelling of the arm, we would use a compression hosiery on you, but please don't apply this yourself. This needs to be done as and when recommended, either from the breast care nurses at Yeovil Hospital or from one of the lymphedema nurses. Other ways that they can treat the lymphedema is by simple lymphatic drainage or using specialised compression hosiery. Both of these are recommended and done by the Yeovil lymphedema service and not the breast care nurses. It's really important that you're very vigilant and that if you do start to have any of these symptoms, please contact us as soon as you possibly can. Watch out for any unusual swelling, changes in sensation, really the achy arm or the aching of the breast. Look out for infection, because if you do have some swelling, sometimes this can result in infection. So please be aware that if it becomes red, inflamed, you must go and see your GP as soon as possible. Now, at Yeovil Hospital, we are very privileged to have a Zozo machine, which has been funded by the League of Friends for us. This is a device that will identify early lymphedema. If you've had an axillary clearance or you've had radiotherapy to the axilla, then we will be doing measurements on you for the 2 years following your surgery. This is so that if we identify you have lymphedema, we can treat it as quickly as we possibly can. If you've just had a sentinel lymph node biopsy, then we would have done a measurement before your surgery. If for any reason this hasn't been done, please let us know and we can start the measurements as soon as possible. So as I stated earlier, if you have any problems at all, please see your GP in the first instance, then come and see us breast care nurses. If we're unable to help you, then we will refer you to the lymphedema team. Thank you very much for listening.